The video demonstrates breast cancer patients' treatment pathway of radiotherapy in Tartu University Hospital. The first step after getting the decision to proceed with radiotherapy is treatment planning CT scan. The patient arrives in the department and checks in with the secretary. The radiographer identifies the patient by asking her name and guides the patient to the dressing room. A photo ID is made to use daily before the treatment on LINAC. To reproduce patient position and minimize their movement during treatment, the immobilization device must be supportive and comfortable. The carbon fiber lightweight breastboard has become the main beneficial tool for immobilization of the breast during treatment. It has advanced arm supports with no interferences in the supraclavicular region. For this demonstration is the breastboard indexed with 2-pin lock bar in a fixed position on the CT couch. The board elevation angle is raised to 7.5 degrees to reduce the dose to the lungs and for patient comfort. The patient will be asked to undress the chest area and instructed to lie down on the board. Adjust the bottom stop according to the patient's anatomy helps to support the patient. It keeps the patient sliding on the board. Knee support is added under the patient's legs for increased comfort. The patient is asked to raise her arms. It is necessary to emphasize to let her arms and shoulders rest naturally on the supports. In each treatment session, the patient is lying in the same position for about 15 to 20 minutes. It is very important that the position is stable, reproducible, and the patient feels comfortable. Any movement can lead to errors of the tumor being underdosed or any errors outside of the target volume being overdosed. That is why it is very important to establish good positioning from the beginning. Every patient is different and each setup is personalized. Treatment setup for right-sided breast and left-sided breast is the same, but the only difference is the method of breathing. The patient with the right-sided breast is asked to breathe normally. The patient with the left-sided breast is asked to take a deep inspiration during the breath hold scan and to hold it for about 15 to 20 seconds. The front of the chest wall must be away from the heart. This method reduces the dose to the heart and the lung. The patient is instructed accordingly to take a deep breath and hold it. If the patient has no trouble with holding their breath, then special goggles are given and visual coaching is done. If the planning CT is done with deep inspiration breath hold method, then it continues while patients have treatment as well. If the patient cannot manage the deep inspiration breath hold method, we just return to the free breathing method. Once the patient is ready for the scan, radiographers leave the patient on their own, but are always watching through the glass window. If the patient needs to talk or something is wrong, there is an intercom and staff can hear all the time and intervene if necessary. All reproducible settings are recorded to an oncology information system. CT scan is made with 3 mm slice thickness with a free breathing mode or coached breathing mode. Scan area, humeral heads to the diaphragm. After treatment planning, the patient is free to go home. It could take about 2 weeks for the treatment plan to be completed. Radiographers import CT images to Monaco Sim software and use it for contouring organs at risk: skin, both lungs, whole heart. For a left breast patient, both ventricles, ipsilateral humeral head, thyroid gland, spinal canal, contralateral breast. Clinical oncologist delineates clinical target volume, planning target volume. For appropriately selected patients, additional doses to the tumor bed is indicated following breast radiotherapy to further reduce the risk of a local recurrence. The oncologist determines the prescribed dose to the planned target volume and chooses a treatment technique. The dosimetrist or the medical physicist calculates the radiation dose into designed specialized radiation fields for each patient. They shape radiation beams right where the tumor is, spare organs that are close to the clinical target volume from an overdose to lessen the side effects. The third step after getting a treatment plan is the patient coming to the daily treatment. The patient is identified by asking name and ID. The oncologist consults the patient. The patient is guided to the treatment room, and radiographers will explain the upcoming procedure. The patient will be asked to undress the chest area. The patient is explained that the treatment position is the same as it was during the CT scan. The patient is instructed to lie back on the board. Radiographers adjust the bottom stop according to the patient's settings to help support the patient. Knee support is added under the patient's legs for increased comfort. The patient is asked to raise her arms and to let her arms and shoulders rest naturally on the supports. Once the patient is treatment ready, radiographers leave the patient on her own. It is explained that staff is always watching through the cameras, and if the patient needs to talk or something is wrong, there is an intercom, and radiographers can hear all the time and intervene if necessary.